Welcome to Osteo, that's with a capital TEA, where osteo warriors in treatment and recent survivors spill the tea on all things osteosarcoma and cancer from the adolescent, young adult patient perspective. Listen in on our honest and personal conversations about our osteo experiences, stories, and who knows what else. This podcast discusses all aspects of the young adult cancer experience in a conversational format. Conversations and language will be appropriate for listeners aged 18 and over. Audience discretion is advised. Like and follow MIB Agents on social media for all the intel.
Welcome to Osteo, everybody. We are back from our Factor conference this year, and we had an amazing time. Us Osteo warriors defeated the doctors in our Doctors Warriors opening ceremony and took back the Golden Bone Trophy from them, which they stole at the last Factor. I personally got to beat my own oncologist, in a donut on a string eating contest, and I did kick his butt, and I will hold him for the entirety of both of our lives. We started off with a pre-factor mingle at Mike Hess Brewing, and then had 8 different scientific panels with 50 speakers. We had wellness sessions and seminars for patients and families, and a healing heart sessions for bereaved family as well. It was wonderful having something for everyone in the osteosarcoma community. And more importantly, it brought us all together to collaborate for a cure, which is, of course, always what we're trying to do here at MIB. Make sure to keep up with our social media, as we'll be sharing more highlights, videos, and photos soon. They took some really, really great shots of everyone in the community. It was really, really a great time. We also have some more events coming up this summer, which is very exciting. This July, for Sarcoma Awareness Month, join us for our virtual outrunning osteosarcoma event. When you run, walk, cycle with us, you can help cause a cure. With MIB Agents, no one walks through osteosarcoma alone, so let's go out running together. Everyone can register at www.mibagents.swoogo.com/outrunning.
This September, we encourage you to be bold and go gold for Childhood Cancer Awareness Month. Make and sell bows in your community, or make a donation this summer and get a bow that shows you care. Contact Anita, ANITA, at mibagents.org to volunteer today. This episode is sponsored by the wonderful organization Osteosarcoma Institute, OSI, which is a nonprofit organization led by osteosarcoma experts from the top U.S. cancer centers, who together are concentrating on the cure for osteosarcoma. The mission of the OSI is to dramatically increase treatment options and survival rates in osteosarcoma patients through identifying and funding the most promising and breakthrough osteosarcoma clinical trials and science. In addition to advancing research, OSI also provides a free resource called OSI Connect for osteosarcoma patients. Our osteosarcoma experts can discuss available treatments, possible side effects, and provide helpful advice for getting the most out of our visits with your treating physician. This resource is available in English and Spanish and aims to help patients and families find answers to their questions.
Well, welcome everyone to the second episode of Osteo, the Osteosarcoma podcast. We are so excited to spill the tea on all things osteosarcoma. Today, we are bringing on our first special guest, Dr. Lori Weiner, to help us spill the tea on body image in the context of cancer. Dr. Weiner is the co-director of Behavioral Health Core and director of the Psychosocial Support and Research Program. As both a clinician and behavior scientist, Dr. Weiner has dedicated her career to the field of oncology and pediatric HIV/AIDS. Thank you so much, Dr. Lori Weiner, for joining us on Osteo today. We are so excited to have you. For those of you who don't know me, my name is Kara Skrubis, MIB Junior Advisory Board President, who will be stepping in today with a few others, since Kerrigan, Vicky, and Camille are unavailable due to osteosarcoma's infamous sporadic events. We also have Mia Sandino joining us, who was just in the ICU 60 hours ago on a ventilator, which is pretty awesome. I mean, not awesome that it happened, but awesome that you're here.
I wouldn't miss it.
To give a brief background on me, I was diagnosed with osteo in January of 2020. I did 9 months of chemo, had a left above the knee amputation, then did 8 months of immunotherapy. I am now a senior in college at the University of Buffalo, studying to become a child life specialist. And now I'll hand it over to Mia.
Well, hello, everybody. It is so great to be back with Osteo. My name is Mia Sandino. I'm 23. I live in LA with my mom and our 6 pets, 4 cats, 2 dogs. It's a full house. I was diagnosed with osteosarcoma in September of 2018. I had a 2.5-inch tumor in my right proximal tibia. I've had a limb salvage surgery, 2 thoracotomies, and about 17 different lung and bone ablations just to blast those tumors away. And I'm very grateful that I'm no longer on systemic treatment. I am Kara's right-hand woman. I am the vice president of MIB's Junior Advisory Board, and I am very proud to say one of her close friends. And yeah, that's pretty much everything about me. Alexis, do you want to do a short intro?
Sure. First off, thank you guys for having me. This is my first time on here. So I'm Alexis. I've been involved with MIB for several years now, and I'm a board member. I was diagnosed with osteosarcoma over, 14 years ago now. And I went through a couple limb salvage surgeries and then had amputation at the age of 18. And then now I'm actually in my 4th year of medical school, hoping to become a pediatric oncologist. Yeah. And Factor was awesome if you guys missed it. It's such a wonderful event. And I finally got to meet you 2 in person, which was awesome.
Nice.
Yeah, but I'm happy to be here and get into this podcast. So I'm excited for everyone to get to know all of us. Moral of the story, we're excited and we hope you are too. We're going to dive on into our first segment, which will open with each and every episode. What's the tea? No, like literally.
So I'm starting off not strong. I do not like tea, so I'm drinking hot chocolate. But for those of you who can't see or aren't watching on YouTube, I have a mug that says I put the grand in grandma. I thought that was fun. I got it from Target. But I just have normal hot chocolate, and I love hot chocolate, even though it's 90 degrees out here in upstate New York. So that's my tea.
It's actually 90 degrees here too, even though it's only 10:18 in the morning in Los Angeles. I'm inland in the valley, so it gets pretty toasty pretty quickly. Thankfully, it's dry heat though, so I'm sorry for those of you dealing with humidity right now. I am drinking some immunity and stress tea with lots of honey because my voice is, a little bit rusty after being on the ventilator. So I am glad to be home, and I am just drinking this yummy, yummy tea in this beautifully crafted hammered ceramic mug that we have in the house. I was gonna bring a cuter mug, but I forgot. So Alexis, what do you have with you?
It is hot here. I'm in Arizona too, so it's 110, but I'm drinking Moroccan mint tea, which I really like. My mug's kind of cute. It's like let it be.
That is cute.
Yeah.
So cute.
Yeah. But enough about our tea and more on the important issue of body image as an AYA cancer patient. For those wondering what AYA is, it means adult and young adults. Feel free to take the stage, Dr. Weiner.
Oh, thank you. Well,
Also, tell us what type of tea you have too.
Yeah.
So, first of all, I'm so honored to be here and to be invited to join you. I think that I've learned so much more from you than I think you could ever learn from me, but this is just wonderful. And I do have a beautiful, I know I have a green background.
Ooh.
This comes with a top. There was a gift from my dear friend, Janet Ashero. And I have in here a tea that is called Cozy Nights, because who doesn't like cozy nights? Whether you're hot or cold, and it is about 88 degrees and very muggy here. I do work at NIH in Bethesda, Maryland, but I live in Annapolis, Maryland, which is a great place. So Cozy Nights It's herbal, and it has mint, sassafras, and chamomile, and it's also nice as a tea latte, which I didn't make. I just have plain tea here. So it is wonderful to see you and to join you. And I was asked to be able to talk about body image, and there isn't anything that I can imagine that is so impactful as dealing with body image changes from the time that you are diagnosed throughout the course of treatment and beyond. And so I put together some slides. I want you to know that the slides are really based from my clinical experience, working with many people your age at different points of the treatment trajectory. And a lot of what I'll be talking about really is in a chapter that I wrote with one of my colleagues, Dr. Amanda Thompson, who's wonderful. And she actually did a session for MIB for parents. Again, I'm going to be starting with just some clinical experiences. And I think about the people who may watch this podcast, and hopefully there'll be a bunch of providers so they could be able to learn too. So let's see. Maybe it doesn't want me to proceed. There it goes. So just imagine the 9-year-old girl being told that she will be admitted to a hospital, will have surgery to place a catheter in her chest, and that she will, even if temporarily, lose her adorable pigtails that she is curling around with her finger. The 13-year-old boy with the gift for playing the saxophone being told that the doctors will need to amputate his arm below the elbow in order to reduce the spread of his osteosarcoma. Nor the 16-year-old who identifies first and foremost as an athlete, struggling with significant muscle loss, weight gain in places that she didn't want, and complications after limb-sparing surgery, and wondering, now being so deconditioned, whether returning to the soccer team would ever be possible. And the 20-year-old person who's post-treatment in a first relationship, but fearful of intimacy as a result of multiple surgical scars, and radiation burns that left her skin patchy and discolored. So what is body image and why is it important? So body image is just our thoughts and our feelings about our entire body and how it functions. It's the perception and satisfaction that we have with our physical appearance. It's influenced by societal and cultural norms, what's taking place in our environment, individual factors, because we're all different, where we're at cognitively and psychologically. Body image develops over the course of our childhood and our adolescence as preteens become more aware of how their body compares to that of their peers and or even siblings, and are increasingly conscious of pubertal changes. It changes by middle adolescence as teens begin to explore their own identity. They may begin to experiment with different images and different looks, haven't we all? And it continues into late adolescence when body image can be powerfully influenced by cultural messages and societal standards of what is a good appearance, an acceptable appearance, and how attractive we may be. It's also impacted by our peers and partners. So children, adolescents, and young adults with cancer worry about how other people see and judge them. It's not just people with cancer, but especially so. And what happens is a lack of understanding and ridicule can lead to problems, such as negative experience with peers or feeling rejected can lead to one just not wanting to be amongst other people, to withdraw. And then they may lose touch with their peers. They may feel lost at school or with a peer group. And perception of physical changes can affect their desire to even go out and to interact with others and establish intimate relationships. And while many people do learn to be able to live and truly embrace the changes in their appearance, there are others who struggle to cope with their altered body image. And so what are some of those risk factors? Well, we're all concerned about appearance and weight, but a real emphasis and preoccupation pre-cancer, having an unhealthy relationship, which could happen with food and with eating. Those who have a hard time with change, what we call a psychological inflexibility, can't think in a different way. those who really tend to be more perfectionistic with the pre-existing anxiety disorders. These could all be risk factors. And there could also be where we're at in terms of disease and treatment factors, in terms of stage of treatment, things that are more visible and changes in how we can be able to function physically. But what we do know is that more positive body image has been associated with lower anxiety, less loneliness, and with a greater sense of self-worth. So what are some strategies to be able to address body changes? Well, first, and we could talk about this later, the support of parents and caregivers, immediate and extended family members, our classmates, our peers, our neighbors, and the healthcare professionals. A supportive home environment is really vital. We need permission to grieve all the losses, the loss of a sense of well-being, the loss of a sense of loss of hair, perhaps a loss of a limb, just all the changes that have taken place. If surgery involves the limb loss, the opportunity to meet others, engaging in activities that promote independence, because this could really help to be able to increase one's self-esteem, to improve how we cope and how we adapt. Participation in adaptive sport, or in starting to be able to engage in new or different types of exercise, which you may not have tried before. Counseling. I think people think of counseling as you have to have a psychiatric disorder, or you need to be able to, have something really wrong with you. It's a gift. And supportive counseling, we all know about supportive counseling, but counseling to be able to talk with somebody who really gets it, who could be able to help you to be able to strategize, to be able to process, to be able to cry or laugh or scream, somebody who could be able to help you to normalize this experience because you're not alone. And there's different types of counseling as well, and different types of interventions, and some that is based on really strong evidence, like cognitive behavioral therapy, which we call CBT, which can help with understanding the relationship we may have with negative thoughts about appearance, such as I'm ugly, or I'm always going to look this way, or subsequent feelings like just of despair, and some of the behaviors that may end up being because of those negative thoughts, which may end up withdrawal from things that you really value, that are important to you. Acceptance and commitment therapy, that also has really strong evidence. And this approach that can help with acceptance of body image changes by using some mindfulness-based strategies, just to be able, again, to look at what's most important to you. What are your values? To help you set goals based on those values, and to take actions that are in line with those goals, to be an accepting place of where you're at, instead of always feeling like you need to change. Being intentional with who you spend time with and how you spend your time. And I can't imagine that we haven't all had the experience of having some toxic people in our life, and that really don't bring out the best in us. But being able to identify who those people are, and maybe making some changes with who you spend that time with. And engagement in meaningful activities where you are giving, but you're also receiving, like here, like MIB, and doing this podcast, which is absolutely awesome. So I work a lot with providers, and I thought that maybe I could just, tell you a little bit of how I suggest that providers talk to adolescents and young adults about body image, and we could just open that up and see if these are things that can resonate with you. And first, it's just to normalize the experience, and to say things like, it's not uncommon to have concerns about changes in physical appearance during and after treatment. These changes can impact how you view yourself. So I'm hoping that we could talk a little today about that. For example, can you tell me how you felt about your appearance before your cancer diagnosis, before your surgery or surgeries? What part of your appearance did you like the most? And how do you feel about your appearance now? How does your body image affect you, your relationships, your social life, your self-esteem, your sex life? And what are the expectations within your family and your culture for your body image? And how does this affect how you see your own body image and affect you in different ways? So I'm going to stop sharing right now, and maybe we could just open up to see if people asked you questions, or have providers ever talked to you about your body image? And if so, what was that like? Did it work well? Did you wish that they would have asked you at a different time or not asked you at all? And how might you have responded to any of those questions? And first, maybe did this resonate with you, some of these slides?
Yes, I had so much to say throughout the whole thing. I was so many great points. I think for me personally, a lot of the providers that I had when I was going through treatment were males. And although it shouldn't have been that way, I think that they were less likely to talk to me about body image and sort of the questions that I did have in my mind. You know, they told me, yes, I'm going to lose my hair, but it was less of, and that's going to change how you feel about yourself, or it might change how you feel about yourself. So I think it would have been super helpful to at least have started those conversations for me, especially in the beginning, like speaking to my oncologist. And, you know, the first meeting I ever had with him, I guess I looked up to him. I looked towards him because he had all the answers, and I had so many questions that, you know, I was a little too afraid to ask because I didn't want to overwhelm myself. But I really looked to him as he knows what's going to happen to me, or at least I think he does, and that he's seen it before, and hopefully he can help me. You know, so I think a lot of those questions would have helped me. Yeah.
No, I completely agree. I mean, it's such a difficult topic to discuss, especially in the adolescent and young adult range, because we grew up with social media, and that has warped our sense of perception of what especially female bodies are supposed to look like. And thankfully at UCLA, I was assigned to an incredible psychologist who helped, you know, with me to work through a lot of my body image issues that I had before cancer, which of course were exacerbated by my diagnosis. I remember my running joke, which is a terrible joke, should not have made that joke because karma bit me in the ass because of it. I was like, well, at least this will be a great diet. And that's what I thought when I first started chemo. And not knowing that I would be on high dose steroids, and instead of working out, you know, 6 days a week like I was, I ended up gaining, I think, about 80 pounds in my first 9 months. So I went from, you know, 140 to about 220, and I was just shocked. It completely changed how I viewed myself. And I always used to have long hair and, you know, these dark eyebrows and these dark lashes, and suddenly those were all gone, and I couldn't recognize myself anymore. And I almost wish that we were warned, almost like a, you know, just precursor, like, hey, you're either going to gain a lot of weight, or you might lose a lot of weight, you might stay the same. There are going to be huge changes to your body, and you have to slowly start accepting yourself for who you are, and realize that working on your physical health might take a toll on your mental health, but you kind of have to find a balance between the two.
Such important points.
Mm-hmm.
Yeah, I think you make a really good point, Mia. I think it's such a hard age when you're an adolescent, because I was 15 when I was diagnosed, and you're still trying to figure out who you are in general and your body image and how you feel about yourself. And then you get thrown into this situation where you lose who you are, kind of, because you're just trying to fight. And then I think another issue is, it's like talking about death. No one likes to talk about it, but it's, you know, a part of life. And I feel like, you know, body image is a huge thing that kind of, as providers, it's uncomfortable now being in the provider role of how to approach that with someone. But I think it's something that's important, because it, you know, affects your treatment as well, even though it's not just the cancer, but how you feel about yourself mentally is a huge thing too. But I think for me, I was a huge athlete. And then I lost my beautiful long hair, and then I gained a lot of weight and got stretch marks. And then I used to like work out every day, and I missed that part of myself. And so I silently had a really hard time in treatment, because I felt like, am I going to date again? Is someone going to be attracted to me with all these stretch marks and these scars and this one leg and everything we've all been through? It's a huge thing to put on someone. You feel that, you know? So that's kind of like my experience a little bit.
I really agree with that. I like, to go a little bit more personal, I had a significant other all throughout treatment, and they were there before treatment. So it was kind of just, they had to accept what was happening to me as well. But since being post treatment, I'm not with that person anymore. So it's been a year since I finished treatment, and now I'm going back into, are people gonna date an amputee, like, and trying to find that worth again, because it wasn't like someone was obligated to be there with me the entire time. I'm trying to figure out, okay, what do other people think of this, and do I care what they think of it? But yeah, I definitely agree with everything everyone has said.
Dating is very difficult post cancer, I found, or during cancer, I guess. I still haven't had any serious relationships in my life, and I didn't really date much before. And I finally put myself out there a few months ago and started dating again, which was very exciting. And then, I was like, this is so exciting, I'm going to be alone with this guy. What's going to happen? I'm not who I used to be, but I feel much better about my body because I've been working out again. And he was the first person to see me naked post cancer, and then he dumped me 3 days later. So that definitely was a major L, for lack of a better term. And it's definitely difficult. I was 19 when I was diagnosed. And I did my freshman year at the University of Washington, which was fantastic. I made a lot of great friends. I was in a sorority, and of course you're surrounded by all these other beautiful women of all sizes, and but you still kind of have that, not jealousy, but just, oh, they're dating, they're doing this, they're doing that. And, I was so focused on academics, and I had such a negative self-view of myself alongside seasonal affective disorder, because it was my first year in Seattle coming from LA. That when I was diagnosed, I was like, I don't know if I'm going to be able to cope with these changes. And when I started gaining a lot of weight, I felt so disconnected from the friends that I had made, because they didn't understand where I was coming from and why this was affecting me this much, when I should be focusing on, my physical health, and that, my doctors are trying their hardest to keep me alive. But it takes such a mental toll when you look in the mirror and you don't feel like you recognize yourself. Suddenly you have all these scars. I have 3 port scars. I have a port in still, all 3 of them keloided. And if I had $1 for every time if someone asked me, oh, who'd you hook up with last night? Oh, and I'm like, no one. These are my port scars. They're not hickey, So it's just very difficult to kind of cope with it, not only in the beginning, but as your body changes, as scars lighten and you get more used to them, as you develop more stretch marks. I had to be put on high dose steroids. So I lost a lot of weight because I was moving so much, because I was antsy, and and I ended up in the ICU on a ventilator because my immune system was so weak, and people kept congratulating me on the weight loss, because I'd lost about 25 pounds. And yes, I'd been, on a different diet, not on the ventilator, but beforehand as well, and moving more. But I was so weak, I'd lost so much muscle just from being in the ICU for 12 days that I looked so much smaller, and people kept congratulating me. And I was like, I'm the sickest I've ever been. It's just very difficult. And I know I'm kind of rambling, but there's so many different directions that you can go in when it comes to body image and cancer. And I'm just so thankful, Dr. Weiner, that there are people like you out there who are, working with adolescents and young adults and pediatric patients like us who are dealing with these challenges.
I think it's like so important to note that too, that like when I was gaining weight from steroids, I was always telling myself that I wish it was the other way, that I was losing weight. And it didn't really occur to me that body image issues goes both ways, until I had a friend who lost a ton of weight, was on a feeding tube, and lost a bunch of muscle, and they were having extreme body issues. And I was like, oh, it's not just gaining weight, it's losing weight too. It's any body image issue. And it's perceived differently by society, like you said, that people would congratulate you if you look thinner. When in reality, I learned to be thankful for my weight gain. I was thankful that I was eating, and I was thankful that I was keeping weight, that I wouldn't have to be on a feeding tube, and that, I would always tell myself when I would have issues seeing myself heavier that once I'm done with treatment, I can work on this. But for now, this is, helping me and keeping me alive. And it's good that I'm eating, and it's good that I have an appetite. So I really didn't think about it before as it going both ways until I'd heard that from friends.
Yeah.
Thank you all for your honesty and your perceptions and your stories. First, Mia, congratulations for getting out there and putting yourself out there. I think that, so many times people just try not to put themselves in places where they could be hurt or they could be disappointed. And in the long run, you can't redo that part of your life. So the fact that you went out there, you got out there, you let somebody see you naked, huge.
I don't even know doing that right now. So I'm like,
You did. Congratulations. I mean, and just hope that you could be able to see yourself as that took a lot of guts. We don't look back on our lives and look on the things that we avoided because we were afraid to do it. We're going to look back on the things that we had the courage to try.
Yeah.
I think it was, Eleanor Roosevelt who said, do something every day that may scare you a little bit to grow, so that is great that you got yourself out there. And when you're ready, you may go ahead and do it again. And there may be a lot of disappointment and there may be some wonderful, experiences down the road as well. And you each spoke about the changes that you didn't really feel prepared for. And I think that is incredibly important. So Alexis says you will be a pediatric oncologist one day. Maybe you'll come to us and do your fellowship. That it is so important when you're meeting somebody, especially in the teenage years, because who doesn't as a teenager look at themselves and their body and how other people see them and where they fit in and try to figure all that out. And then you have like an assault on your body. How could you not feel in one sense just violated? Whether it's been for a port or a hair loss or, your bone marrow, your LPs or whatever else that may be going on, or surgeries, and to be able to stop at every step of the way and to say, okay, we're talking about your medical plan, but now let's talk about you.
I'm interested to hear everyone's thoughts on social media. I know, Mia, you touched on it a little bit before. I think social media can be so harmful when it surrounds body image, but at the same time, I feel like that's one of the major things that helped me. Just through finding like other amputees. I remember, Alexis, you were one of the first people through MIB that I had met, and seeing your pictures on Instagram, I was like, oh my gosh, this is like an adult who is living her life, who, yes, she has one leg, like that makes no difference in her life. And that was beyond impactful going through treatment, seeing people out there that I could be like, okay, this is normal. Like I'm not less of a person. I can do everything that I want to do. So I think that I think it'd be interesting. I feel like parents would think to keep their children off of social media for that way, but at the same time, that's where I got a lot of strength and hope. So what is everyone's thoughts on that?
I'm aging myself a little bit, but when I was in treatment, there was no social media. Really, like social media wasn't big yet. But I wish I would. Yeah, we did have MySpace. Yeah. But I wish I did, because like you were saying, Kara, it would have been nice to see, because had limb salvage surgery 3 times, and then I came to a point where I either had to decide on amputation or not. And I was so scared because I had no idea what someone's life could look like as an amputee and what you could do. And I was really wrong. I'm a normal person. I date, I work out, like, but I was so terrified because I had no one to look to, really to see like what a life as a woman could be like. And then I met another amputee through CAF, Challenge Athletes Organization, and her name is Tara, and she was awesome because she came and saw me and kind of did the same thing for me of kind of what my life could look like. So I think social media and groups like this could be so powerful. Like I wish there was a podcast like this when I was in treatment, because you feel alone and you feel like you can't connect with anyone, like your friends and stuff. Because I mean, they're there for you, but they don't really, as you like understand like what's going on and inside and internally and can't relate.
Yeah. I mean, I feel like social media is such a blessing and a curse, and thankfully there are so many more body positivity accounts that are out there on TikTok and on Instagram, and I don't really go on Facebook. I don't have a Twitter, but it's there's so many different options that you can go to, but it's so hard, especially at the beginning, with your peers. So you meet people on vacation, or just friend of a friend that you follow on Instagram, and they're on all these amazing vacations and these bikini pics, and it's spring break and you're just hiding, not hiding, but you're stuck in a hospital room and you're like, I feel like I'm disconnected because I can't, it's like, keeping up with the Joneses, like it's, you're just, trying to fit in and find yourself again. And sometimes not having that identity can be harmful. But once I started following more not only body positive accounts, but more like mental health guidance accounts and things with just little bits of inspirational stuff. I don't like things that are too cheesy, but just finding things that you could train yourself to see yourself in a better light is really, really helpful. But it was hard because I know that this sounds so stupid and shallow, but I was like, oh, when I was in high school, it's like, oh, it's spring break. It's time for my, spring break bikini vacation pic. Like, I don't know why, but I had like 6 years in a row where I just had them. And, I went from being, a 38, 25, 38 to, I was just in the ICU a couple days ago and they have my weight written up and it said 221 pounds. And I didn't think that I had gained that much weight. But I did break my ankle a month and a half ago, so I haven't been able to work out as much. But I still think I look great. But just seeing that number and being in kind of a sedated state in a traumatic environment brought me back all those bad memories, and I just had no option but to look there because it was in front of my face, and I was just constantly being reminded. And I think that a lot of with social media as well, there are ads, and the ads can come up and they'll be like, oh, this is how you can lose 30 pounds in 3 weeks or whatever. And it's so toxic, and it's not an account that you follow. It's just something that might pop up, and that can really, just seeing that one ad can potentially ruin your day. So social media is a blessing and a curse, and it's hard being in medical environments and being bombarded with what your truth is, and if you're not ready to face it. But it's hard to find yourself and find your social media presence again, because like you said earlier, Dr. Weiner, you're grieving your former self completely, and you basically have to reinvent yourself and find yourself again. And that can be really, really difficult. And I feel like you all have experience with that as well.
And it's giving yourself the permission to grieve.
Yeah.
Instead of just going, well, I should be grateful I'm alive, and I should be, to be able to say, I'm feeling sad, and that's okay and appropriate. And there may be days that you're not, and of the times that you're very excited and feel really good about your appearance. But there are times that you just recognize that things have changed, and it is a grieving process.
Yeah.
I know sometimes people will say, okay, I'm going to turn this around in a way. So I have all these scars, and you can see those, each one of those scars being, ugly scars, but they're warrior. You guys are warriors, right? You're osteo warriors. They're your warrior scars, and each one can have, you can make your own story for each one, for what that was like and what you got through each one at different points of your life. And that's so inspirational to other people that you may meet, those warrior scars, and look what I went through, and here's my proof, the visual proof of who I am. And who doesn't want to be around a warrior, right? And who doesn't want to be around somebody who's appreciates every day, appreciates tough times. And
I
that's
think
all.
that's a great point about you do grieve, and then I don't know, I feel like it took all of my 20s, and now I'm going to be 30 in a month to really be okay with who I am, to be honest. Like, it took me a very long time. I had to grieve and be sad, and I avoided dating because I was always afraid of being rejected for my leg. And I just recently started to go out again too, and it's actually, I've been really surprising. Everyone's been, pretty open, and there's some that aren't. But I kind of turn it away to say like you said, like these scars are something I went through, and I'm pretty proud of what I've been through, and I'm tough and I'm lucky, but I still have those days where, I think everyone does, where you're just not feeling pretty and you don't feel good about yourself. But I like to look at all I've been through and I've accomplished in my life, and it's pretty cool. That's how I kind of deal with it.
So Alexis, what helps on those days?
When I'm sad,
Mm-hmm.
I like working out a lot. Working out is my stress reliever. So if I'm feeling sad or upset, I'll go to the gym, and that makes me feel better. Or I'll talk to my sisters about it, because they're normal 20-year-olds who have the same body issues too. I think everyone in society, it's a whole culture thing, I think, too. Everyone struggles with how they feel. So I think talking to my sisters about it, or I'll cry. Sometimes it's good to have a little cry and still grieve it. But I think going through my 20s and at my 30s, finally reaching my 30s and going to therapy and working through it and stuff, that I finally, feel comfortable with who I am.
I think something that helps me still today is, struggling with body dysmorphia and learning more about body dysmorphia, that on the days where I look in the mirror and I see someone who in my mind is massive, that is not real, and that body dysmorphia is called body dysmorphia for a reason. And that, it's just, how often do we all look in the mirror? There's no way that we're going to see every small change and it's going to blow up in our minds. So just reminding myself that, sometimes your mind plays tricks on you, and that one day you're going to feel different than the next day, but you might not be exactly how you think you look. I think going through treatment, I was non-weight bearing for a year and didn't start using a prosthetic until a year after. So I was not up on my leg much at all. And so I couldn't quite reach the mirror every day. So I didn't look at myself in the mirror every day. And I feel like that kind of helped me, because I was not looking in the mirror every day to see what changes were happening each day. I had the same thing of when I was having methotrexate, they'd write my weight up on the whiteboard so that they could, calculate it day to day. And that was a little hard to see every day, but I wasn't actually looking in the mirror every day, every hour to look for those changes myself. I was just there trying to get through it and trying to go along with my day, which I think helped me in the end, because, I told myself it is what it is. And that once I'm done with treatment, once I can work out again, then I'll start to work on myself. I'll do what I need. But for now, I was just surviving and getting through it.
Yeah, I mean, it is hard, especially when you aren't looking in the mirror for a while. I had 55 nights in the hospital just in between September and November of 2021. and it was a lot, and the lighting's never good in a hospital. But I found what helped me a lot, just throughout treatment in general, but especially over the past couple of years, I've really gotten into skincare and makeup way more than I used to. Because and I hate that makeup is called makeup. And the reason why is because, it's supposed to be, like making up for beauty that you don't have, which isn't true. I think makeup is a wonderful tool to use to enhance the things about yourself that you love. And, you get to play with colors, and it's a creative outlet, because I have very shaky hands. I have terrible handwriting. I don't like writing. I don't like drawing. I don't like coloring. I'm not a talented musician. I don't have many creative outlets. And suddenly I get to play with my skincare, which makes my skin clear up, which makes me feel better about myself. And then, I start messing around with makeup, and it just turns my face into a canvas, and not someone that I don't recognize, but something that I can just have fun with. And like, oh wow, I never realized how beautiful, just this, little bit of glitter makes my eyes seem, and how much bigger they look, and oh, I guess I do have beautiful eyes. And oh, when you look in a mirror that much, you start to appreciate the things that you do love when you view them in a more positive light in that way. And it's definitely self-care, so you're taking care of yourself, and it also helps stimulate growth. And I think that that's really been beneficial for me. I don't know if you guys feel the same. But yeah.
I think that's a great point, Mia. I think for me was stop trying to do things to attract other people instead of doing things to make myself feel good, and to be my best self. And I think that's lovely that you do makeup. You look beautiful. But just doing it for you and not anyone else, I think, is how I look at it, is doing it for myself, doing my makeup and hair, not for anyone else, but to make I feel like empowered and feel great about myself. And I think that comes across to other people as well too. But that's kind of how I've changed my mentality with that, instead of for other people, but just for myself.
Yeah.
I think like having that mentality throughout like treatment and sometimes after too helped me a lot too, that like this is my time, like I'm gonna focus on myself, I'm gonna do what I need to do to get through today, and tomorrow I don't owe anyone anything. I don't owe them, if I don't want to text back, then I'm gonna take my day, I'm gonna just survive and do what I need to do.
As you should.
Permission.
Yeah. Anything else that we want to cover before we wrap up?
Question for you. We're all female on here. So if you have some males with osteosarcoma that are going to be watching this, any words of wisdom for them?
I would just say that you are more than your external appearance. And that's not to diminish any negative feelings that you have about your physical appearance, but it's temporary. And there are some things that may be permanent, but even if you're perfectly healthy, your physical appearance is always going to be changing, either with age, or even if you move from a warmer climate to a cooler climate and you get less tan and you just don't feel like there's so many different things that can happen. And just take a deep breath and realize that you are more than your external appearance, and just take teeny tiny steps to do things that make you feel more like you, and that will help you feel more like yourself internally and externally, in my opinion.
Man, that was so poignant.
I think what I would say is like, I mean, it's a long time coming, but I think we're just starting to recognize the lack in the male mental health community. And, I don't even think we've touched into body image for males yet, but like just that most of us, I hope a good amount of us like recognize that that is lacking in the community, and hopefully, with helping uplift providers to talk about it, and parents and friends and everything, that it can get better for males too, because I know that's been a serious issue lately.
I agree with everything everyone said. And I think if like Dr. Weiner said too, if providers are listening, I know it's really hard. Like I even get that mentality of you go in, how are you feeling? You ask your certain questions and leave, but just, having those check-ins mentally for males and females, because it's a lot going through this. And I think it's something that doesn't get addressed, and it should be.
I think there's also such a negative connotation with men and balding. So a lot of men fear receding hairlines and things like that, and so suddenly if you're losing your hair and you see all like these Rogaine ads or whatever they are, and you're like, oh, I'm not supposed to be bald, I'm not supposed to be this, it's almost looked down upon in society, and I feel like it really shouldn't be. And I feel like that's something that should be touched on specifically in the cancer community. But I think body image is just so crucial to talk about for all genders. And I just think that it's so great that there are providers like you, Dr. Weiner, and people who are actively working to help people feel more confident both mentally and physically. So thank you.
Now, we didn't even touch upon just transgender, or just where body image again is just so incredibly important. And then you add cancer to that.
Yeah.
If you think providers aren't comfortable talking about body image,
yeah,
layer on top, right?
And cancer treatment changes your hormones so much as well. I can't even fathom if you're transitioning and you have to suddenly go through all these steroids impact your hormones so much as well, and if you need Lupron shots or to shut down your reproductive system, and it's just a big hot mess.
I think that's we could go on for hours about that too, because even for me, I identify as a female, and I lost my hair and I started to be called sir, and for me that was not the best thing, but it didn't necessarily I was okay with it because I understood why, but I could understand how someone transitioning that would be very, very hurtful. And if that's what they're struggling with in everyday life, then that would be just a whole nother ballpark.
And provide potentially using dead names and stuff like that. I mean, it can really, I'm sure it takes a massive toll.
So in addition to being really sensitive and asking about preferences and pronouns, it's always going back and asking about body image, about what your body image was like prior to this experience. What's it like now? What's the hardest part for you? Where would you like to be? What would make you feel more comfortable? And then reaching out to people like each of you, and to know there is life, and there are strategies, and there is hope, and there's okay to grieve. And it's also to be able to be okay to celebrate the things that we tried that worried us or scared us or frightened us, because that's makes us feel alive, right? You guys are so inspirational. What an honor to be with you on a Saturday afternoon.
Oh, thank you. It's an honor to be with you.
Yeah.
No.
Well, I think we're just about out of time. So thank you for tuning in to Osteo, the Osteosarcoma podcast. Make sure to follow MIB Agents on social media at the links in the description for all the intel. Feel free to drop your questions about body image, anything that we touched on, and hopefully we'll address some of them in the next Osteo. Thank you so much to Dr. Lori Weiner for all your knowledge and your hope. We're your hosts, Kara.
Alexis. Oh, sorry. Alexis. And until next time, that's the tea.